How to do a research project. Module 2.1, Translate idea into a specific study objective. The second module of this course consists of executing the research study and has 5 submodules. 1. Translate idea into a specific study objective. 2. Choose which study design to use. 3. Select exposure and outcome variables. 4. Select potential confounders. And 5. Decide how data collection will be undertaken. We are currently on submodule 2.1, Translate idea into a specific study objective. The learning objective for this module is to translate a research idea into a specific research study objective. After coming up with a broad idea, the next and sometimes difficult step is to translate that idea into a specific study objective. When coming up with a specific study objective, researchers often ask, why is it so important to be meticulous in narrowing down the broad idea into a specific objective? The following provides answers to these questions and reasons why narrowing down a broad idea is such an essential aspect of designing a research study. The foundation for designing a new research protocol is the study's objectives and the questions that will be investigated through its implementation. All aspects of study design and analysis are based on the objectives and questions articulated in a study's protocol. Consequently, it is exceedingly important that a study's objectives and questions be formulated meticulously and written precisely in order for the research to be successful in generating new knowledge that can be used to inform decisions and actions. In the following examples, we will examine how researchers narrowed broad ideas into specific study objectives. In the first example, we will examine the broad idea that questions women's understanding of the term pap smear. Specifically, the objective of this study was to assess understanding of the term pap smear at a clinical site, specifically among Spanish-speaking women, across the entire adult lifespan. The study also aimed to compare how Spanish-speaking women understood the term pap smear to English-speaking women. In the second example, we will examine the broad idea that looks at physician support for over-the-counter contraception. Specifically, knowing that OB/GYN physicians and family practice physicians are the primary prescribers of oral contraceptives, this study sought to ascertain the attitudes of primarily resident physicians in these fields towards an over-the-counter prescription transition for both combined oral contraceptives and progestin-only pills. In the third example, we will examine the broad idea that concerns racial differences in preterm birth. Specifically, Black women in the United States are more likely to give birth to preterm and low birth weight infants than their white counterparts, but little is known about variation in birth outcomes within the Black population. This study aimed to test the hypothesis that the risk of low birth weight and preterm birth within the Black population varies by maternal ancestry and nativity. In the fourth example, we will examine the broad question, does oxygen help people having a heart attack? Specifically, the researchers conducted a registry-based randomized clinical trial to evaluate the effect of oxygen therapy on all-cause mortality at 1 year among patients with suspected myocardial infarction who did not have hypoxemia at baseline. Once the researcher has narrowed a broad idea into a specific study objective, the researcher can then choose the appropriate study design. This will be the subject of the next module. The next section in this course is Module 2.2, Choose which study design to use. The learning objective for this module is to choose an appropriate study design based upon research study objective.